can't even tell you what day today is. It's Friday, May 9th. This is House Healthcare. And we're gonna round out a long week that we've had. Okay, it's all okay. We're gonna round out the week just very shortly, and then we'll be out of here. And I just wanted to have some committee discussion. We have, if you will notice, our wall, absolutely everything that came over from the Senate has now out of our committee. We've got three bills on the floor next week. S63, S53, and S126. So excited about that. And I think I just wanted to, since we still have a couple bills that probably will come over from the Senate, House bills that we passed out that they still have. They're actually taking up today. They have votes I saw on their agenda on H266 and H482. So we will have that. But for the rest of the session, we don't have a ton to do as far as committee goes, but we still have to keep occupied because we're still at work. And I thought that maybe this might be the opportunity to think about things that committee members are interested in and possibly taking up testimony for next year, or at least maybe be introduced to topics. If anyone has any burning desires to do anything. Daisy, do you have the list that we did what feels like forever ago on committee priorities that we did it right before crossover, I think.
Can you come back to me?
Yes, I can come back to you. I see you're. Yeah.
It was before the bills were in committee when we did that.
Yeah, I know.
It was before crossover, before we went on town meeting break, to sort of prioritize what we thought we could get done prior to that. Prior to the crossover, which was amazing, by the way.
Topper and I discussed that list yesterday, and one suggestion I have is that we focus on this. If we refer to that list, here's the risk we run, is that we have to go through again, reminding ourselves what priority policies were in that list that we each had named that got rolled into other bills, got rolled into the budget or the BAA. So a lot of the priorities that we each had were kind of taken care of in various ways. And so there are bills up here that didn't move, but moved into other things.
Yep.
So I think that it might be, my suggestion is we start fresh because that list is very duplicative, if that makes sense.
Yeah, makes a lot of sense.
Okay.
Thank you. I was thinking about it as more as refreshing people's memories of, oh yeah, that was a priority.
Yeah.
Of mine, but Brian.
I think that there's a lot at play. And a lot of the bills up here were written without that in mind. And so what I wouldn't want to do, and people may not like this, but what I would not want to do, but people out in the world might not like this. I don't think we should spend a lot of time taking testimony about why we should extend this benefit and extend that benefit and extend this one and extend that one, because that is just setting us up for failure right now. I actually think we should be looking, if anything, it should be, what is the contingency plan if Medicaid goes away? What is the contingency plan? Like, what are the numbers? Like, if we, maybe, I don't know how busy Nolan is, so if Nolan's busy, forget it, but like looking at the numbers of like, how much would we need to come up with to keep Medicaid solvent? How much, like, some of that would be helpful in my opinion, because that's where we're at, versus being like, it'd be great. And I don't want to use an example because then someone will be offended. I'll make something up. Like, it would be great to like give everyone a second head paid for by insurance. you know? But like, that's why I use a far-fetched example. You know, we can't afford that right now. What you look is like, how do we preserve our head without insurance? You know what I mean? Like, that's more the angle I think.
Yeah.
Okay,
TFO already has that info.
Yeah.
Yeah, so maybe we could get a presentation.
exactly.
Yeah.
JFO, I think on their JFO website is keeping track of changes at the federal level. And of course, we did have the joint hearing with House Human Services, that I remember Monica Ogilvy,
Clarify this with.
yes, scared us to death. And I will say that I don't believe that the information that we received at that hearing has changed a bit, if only perhaps some of those numbers went up. But I think everybody is just sort of sitting around waiting for what shoes are gonna drop on the federal level. And I don't think there's any more clarity today than there was when we had that hearing. There will be more clarity, I'm assuming, when we are back here in January. So we could get an update. Should we have Nolan? Should we see if Nolan can give us an update to?
Yeah, or a summary of it all, like some sort of pull it together, give like synthesize like something we can go back to our constituents with.
Mhm.
But second, maybe some time for discussion about what are the options for reacting? Like we have the emergency whatever committee, the joint fiscal committee.
Mhm.
And maybe considering as the budget's being finished, like how that, there's gonna be language in the budget around this, like. How does we make sure that it addresses healthcare?
Yep. So update on federal funding and the JFO's tracker that they're using. I think it's called a tracker.
Yeah.
I wish no one was here.
The Hunter?
Yeah, sorry.
That's
Track
for
record.
federal funding.
Yeah, tracker keys in.
Um,
For welfare.
what about the state treasurer too? I'm having a community forum with him about that, just to talk directly to my constituents
Mhm.
about risks. I mean, that'll involve him and another person who works with migrants, but just specifically to federal funding in the unique environment we're in right now.
That would be interesting to hear what he has to say about how the state can manage existing funds to maybe provide some security. Like he might have ideas, or there might be things we can do with healthcare money that are creative. Like we did with the medical debt, you know?
He's very creative.
Yeah.
Yeah.
Leslie?
So we've already lost a lot of money, unfortunately, from the federal, food pantries are shutting down. CDCs couldn't deploy a response in an emergency.
Yeah.
So I'm also wondering about how we respond in emergency. Do we have a rapid response team? How do we respond nimbly and fast when these things are gonna be like blowing at us, and they're already blowing at us at, Head Start, rural health, maternal health, I mean, over many sectors across the country and our state. So,
I think we always concentrate in this committee on, like Medicaid, and federal dollars for that, but, we've failed to recognize all the grants
right.
that various organizations use to serve the needs of Vermonters, which of course in turn affects their health greatly.
And then there's the long-term implications of health on losing preventive services. I think the impact on the health department, which is what we heard a lot about, I think we just need to keep it really in front of us, so that we can respond nimbly when we need to. I know it's gonna go through HROC when we're off session, but we may need to come back. I'd be curious to know what conditions should exist should we need to come back as a
I
committee.
agree.
Because that has happened,
There's
there's,
language in the budget.
yeah.
Actually, the healthcare advocate like to testify, you don't have to sit down in the chair.
Yes, you
Do you know exactly, are you tracking what the language, I apologize, I've not been tracking what the language actually is in the budget.
I think it.
Hello.
And my thought when I walked in the room, are we on the record? We must be. My
Yes,
thought when we walked in the room was, wow, you guys are unsupervised. Nobody in here.
Committee discussion, nobody bothers to even show up around
We're on
here.
YouTube though, we are being watched.
I mean, we were threatening to do things to see who would show up in the room if we said, it's like, house healthcare is, we're gonna pass a law saying healthcare is in charge of the entire healthcare system.
Yeah.
Whatever, it was all the hospitals.
See who shows up.
To which I say, wait a minute, you're not?
We're actually bonding. It was nice.
No, we're talking about just sort of what we might want to use to fill our time, and it seems like there is a lot of interest in hearing about more federal updates. Oh, would you happen to know what's in the budget language?
So
Triggers.
there is I think it would be very easy to pull up, I can't do it at this moment, but, or very easy to have your alleged counsel walk through the language that has triggers for, different levels of changes to the budget need and sort of when joint fiscal gets to make a decision and when the legislature needs to come back. I think it was 5% that requires the whole legislature to come back. And then there was a different trigger for 4 and for 3, I think. So I looked at it a while ago. There is forever and ever attention about delegation of authority and how much it is appropriate for the legislature to give power to a subset of yourselves, the Joint Fiscal Committee, and how much it really needs to be the full legislature. So I was appreciative of that language. I thought it was clear. I think, yeah.
Okay, so I'm hearing a lot around that, so we can work on sort of expanding that out on what we'd like to hear. So I'm curious, oh, go ahead.
Something Leslie said that I don't want to lose before we move on is when you were talking about funding outside of healthcare finance being affected, you were talking about social drivers and determinants of health. Maybe we could hear a little bit about how these federal policy and funding changes are going to affect the social drivers of health and how that might create how that creates effects on healthcare and health and wellness for people. And then how might that affect cost of the healthcare system?
So it's both long-term health and
Yeah,
long-term
exactly.
costs, yeah.
Exactly.
I like that and thinking about it more holistically.
Before we moved on, I wanted to just.
Thank you.
In getting testimony from representatives of those folks that will be impacted.
What do you mean? You need to.
Or a public hearing.
The people that Leslie and Brian are talking about, hopefully some of them have organizations or agencies that are advocates for them. Or maybe, you could find some folks themselves that could talk about how cuts would impact them.
The cuts themselves like that.
We had, and I don't know the acronym because Human Services always deals with, but the various designated agent, not
Community action
designated, the
ones.
community, yes.
Yeah.
And remember, she came in here, which was the first time I think I've ever had heard of, and listing, she was just listing like all the grants that are going away.
Right.
So, maybe we have community action
That would be a great idea. 'Cause
Networks.
network.
I think I could give you a little update about what is on the federal landscape around the exchange, around the insurance market. I think we all know that without federal action, we lose the enhanced tax credits. And that is valued it has been estimated to be valued by DEPA at $65 million loss for Vermonters. And that is loss in buying power.
I had,
I agree with you, but the problem is, I don't know how we're gonna champion that.
Well,
You know what I mean? I'm thinking that, I
So-
know that with.
federal action required to continue it. And I agree with you, the prospect of the state, it's already passed, the ship has already passed. The prospect of the state backfilling that is untenable, doable. Secondarily, there has been, or recently in the last couple of weeks, there's been a few CMS memos about, I apologize, silver loading.
Knew you were gonna sound like, oh no, he's gonna go to silver.
And I just want to say out loud that there is some confusion about the term, that most states, about half of the state, so when the federal government stopped funding the CSR, the cost sharing reduction, the monies that we give to Vermonters to help them with their out-of-pocket costs, about half the states, Vermont included, did a silver load to fund it. So in other words, we figured out a way to finance it. And it sounds like that specifically, there is some clarity that there's an expectation that the budget that's going to come out maybe today or early next week is going to may include the CSR monies and telling
What budget?
states.
Federal?
On the federal, yes.
Okay, you kind of shocked me a little, because I thought, wait a minute, I didn't think we were that close here.
Yeah,
The budget reconciliation.
yeah.
Thank you. And so can you repeat again, because that just threw me off, like, it's gonna have what in it, let's see.
The funding for, so in the first Trump administration, the administration stopped funding the CSR monies, told insurance companies they still had to keep doing it, just stopped funding it. And it sounds like there's a likelihood that they're going to fund it again and tell states they can't use a silver load to fund it.
What's the estimated?
Difference.
And
Back down that one.
so, and then you may recall that Vermont went a step further, and I'll say appropriately valued the high CSR levels. A silver 94 is a platinum. It shouldn't be rated as a silver plan. It's a platinum plan. It's actually better than a platinum plan, and it should be rated as a platinum plan. That's exactly what we did. And I believe, I'm going from memory here, that the Marketplace report said that if the combination of the loss of enhanced tax credits and we went back to our silver load 2 years ago or something, went back to our previous silver load, the total was, I think it was 115 million.
That's not from the state, that's out of the pockets of Vermonters.
Out of the pockets of Vermonters. It's loss in buying power. And so that, those changes will play across Vermonters in a very different ways for different populations. Sort of most notably, shockingly, will be people who are just above 400% of poverty, who will lose all subsidies, who would, in this scenario, lose all subsidies. And so there's some, I guess, on Monday, when the rates are filed, FYI, Vermont is the first state to have rates filed. And so there will be a Vermont story that I think might be interesting to the whole country, to be able to model, estimate sort of the impact on Vermonters if the federal government does what it sounds like they're going to do on those two things. If I keep speaking, I just go further into the weeds.
That's fine.
Sorry.
We could always make time for this though with other people here and have a really planned discussion, structured, a little more structured too. So that, because it's hard for me to process everything right now, but maybe if, I'm not trying to make work for you, but your office does make nice graphics. So like if there was some graphics, to like, because we are going to need to be sharing with people this information and helping them understand it. And it's hard to understand sometimes because there's so many gears in this machine.
And I think it would be useful for you and for others to see, okay, family of 2 at this income, or family of 4
Exactly.
at this income.
Exactly.
Here's how it plays out differently. And I'll just say it's going to play out very hard.
For Lori, we were just having committee discussion and then nobody was in the room and Mr. Fisher realized we were unsupervised and hightailed it up here. And then we made, then we made them sit down and.
Actually, not so. I had no I was not peeking. I just opened the door and saw that you were unsupervised. And
We were talking about what we should do with the rest of the time that we have. And when he came in, we had pivoted from bills to federal stuff. And then he came in and it just made sense. And now we're like,
Depressed.
yeah. I mean, I think you may also, you know, by next week we may have some concept of Medicaid changes and,
as soon as next week.
Is there then some sort of preliminary report out there?
well, I think you.
Leaks, I guess.
There's lots of guessing happening out there and, you know, you hear that, you know, this is on the table and this is off the table, you know, and so I have no special knowledge of anything. It sounds to me like the major component that continues to possibly be on the table involves our, provider tax.
Oh, there was a big article in Times.
It was.
Yeah.
What about that?
The provider tax. And so DEVA estimated that a reduction of loss of half of our provider tax was worth $250 million. And at least according to the New York Times story, that there was discussions of half or all. So I've been saying 250 to $500 million for Vermont.
So they get 250. 250.
Or up to 500 if we lose all of it.
Oh, so that, yeah.
And this is the tax that big healthcare providers are paying?
Yeah, I mean, we fund our Medicaid in part with a provider tax, and it's. I know that news story talked about it in all kinds of different ways. It's a local match.
Yeah.
We raise money and we use it, and it goes into the general fund, and we use it to fund our Medicaid program.
Which was the
It's
intention
as simple as that.
Intention.
And
originally.
You give us $1, we'll turn it back into $2 and change, and
So in its-
we'll give it back to you.
in its original form, it had that concept, but we're a long ways from that. You know, the state raises money in all kinds of different ways. And so the state raises money for the general fund, in part through a provider tax, and then we choose to spend as much as we choose to spend on Medicaid. And there's no cycling of money in that, in my mind, it is, you know, we also, we raise money for the general fund in many, many different ways.
But also, you know, I mean, we have to think about every single time we do something like we want to raise the rates of this or we want to raise the rates of that. That's, you know, we need that general fund money to be able to get matched to give those rate increases or expansion of services like us.
Well, it is entirely possible, maybe you started this conversation before I was in the room, that 226 is being voted on right now.
26,
260.
260.
The PBM,
266.
the 266, the 340B bill, and
42 is.
482 also this morning. And so there's some new ideas in 266 around prescription drugs that I think might be good for you guys to contemplate.
Yes, I think that,
You from when it passed out of our committee?
I think that there is testimony that we will, I'm waiting to see what testimony we have to take.
Yeah.
Waiting with bated breath for the Senate to see what they vote out. So any thoughts on bills that people would like to work on, maybe over the summer?
Start, take a little bit of testimony on the naturopath, PA, NP.
That's the Colst one, right?
Yeah.
That's on my list. What number is that? 271? No.
Read from here.
I always lose that in here, and I think it moved. was next to 71 for a while. Oh, 75, each 75.
Yes.
Yes. Four.
Yeah,
Okay,
that was on my list too. I'm gonna make a tracker for us, okay?
okay.
Put it in Google.
I got 320, 323, 302, and 136. One at a time.
Okay,
320 is stabilizing Vermont Rural Hospitals.
okay,
323 is the mental health. It's some kind of special fund.
oh, that's Daisy's.
Mine. That's like a youth mental health and school-based mental health focused one, right?
Yeah.
And then 302 is Medicaid coverage for fertility.
Great. Okay,
Well, I got one more.
okay,
H136, and it isn't because of the biomarker people being downstairs.
oh, they are in the building today, actually.
Yeah, but that's not why.
Yeah,
I just think that that can do a lot to pick up stuff. And can help people, like, I'll give you an example. If, let's say, if I knew who the hell my father was, something went on in his life, or my mother, and I was going to be suspect to that. You know, I might, there was a good chance that I'd like to know about that so that I can prepare for it. And also get the proper treatment. And what goes through my head all the time is Lyme disease. And I know that's not inherited, but there's always, when a doctor sees you, they diagnose you for something else. And it takes forever to get to the point where you're really being helped. I think the biomarker thing is a way to do that.
I have a question about that.
Sure.
Do you know, or does anybody, any of our clinicians know if, like, autoimmune disorders, which are prompted when folks, like myself, get COVID and have long COVID, right? It just exacerbates or triggers those. Would this bill, does it have things in it that would help folks that are living with autoimmune diseases?
Well, the bill won't have to say,
Yeah, I don't need.
Biomarkers.
you know, how that. There are definitely biomarkers for autoimmune. How it fits into long COVID is sort of.
Got it. Okay, yeah, that's my question, is about autoimmune and biomarkers.
Yeah, that's a definite.
Is this a
I think there-
first?
There are, for example.
Yeah, thank you, Mike.
A genetic disposition to the MTHFR. If you're heterozygous for MTHFR, you
What is
have,
that?
it's a genetic mutation that does a number of things. It causes your homocysteine levels to increase, makes you more susceptible to blood clots.
Yeah.
So there is a connection. It's knowing that, and knowing that COVID, we know, is also an inflammatory disease for vascular issues and can cause blood clots, does cause blood clots. It would be helpful to know ahead of time, your primary care provider might want to treat you around the blood clot issue when you get COVID, for example.
Yeah. And that's what a ton of stuff I'm thinking
Can
about.
I give an update and then be excused?
yes,
So 266 is voted out.
I guess I'll have to
Thank
look into
you.
that.
was there any addition to it?
It appears to have passed without any
Oh,
changes, so
without any changes?
white bagging in it, I presume. I'll let you know if I hear it.
Oh, look,
I'm sorry.
without any changes from like the last day or so that they had, okay, I thought you meant like they just passed
No,
our
no, no.
bill
No, no.
in concurrence. So it still has the white bagging in it?
I believe so.
We need to line up testimony next week about white bagging.
And I'm gonna go down and listen to 482.
Yes, thank you.
Thanks, Mike.
Any updates would be greatly appreciated. Thank you.
including why we included it the first time.
Yes. Yeah. Yeah.
Good.
Oh.
Changing of they are.
You cannot leave them alone.
They're tag team.
I know.
Okay.
We'll have universal health care.
11:20, 11:30 will be somebody else, 11:40.
Have you been listening to us?
A little bit.
Okay.
We were threatening various things to see which advocates would show up.
Oh, I don't think I would.
All right, so Topper's got 4 things he wants to look into.
Okay, no, you can.
I have a couple, but I'm curious to know if, about a conversation about adding to Medicaid costs, given our current, like, do we just feel like maybe even though as much as we'd like to, that's not a good process, a good time to, or is it just, we'll get testimony? Because I'm interested in the prosthetics bill, and PT. I'm interested in the Coles bill.
What's the number?
432.
432, yeah, and PT is 271. Yes, on the coast, that's 75, yeah, to expand that. I didn't find the exact number for private equity, but I think we should 71, start thinking about that, because I don't know what the costs, if there is any, but at least we can think about it.
Definitely private equity, thank you.
Yeah, and pretty exciting, actually. Next Wednesday, I think it is, Kristen, next Wednesday, one of the students that did their research project around the private equity, they're coming in to present to us.
Awesome.
So really excited about that. Was thinking it might not work because I know Middlebury College is finishing up their term and.
They're also having a demonstration, so they're, this is over there.
Okay.
I had one more, compacts. I think we should, compacts,
Oh, what do we have
Means of the
for, oh, we
nutrition.
have the dental.
It is
Psychology.
psychology and nutrition.
Nutrition.
Yeah, I think there were a couple of them, and they seem kind of straightforward and, expands our workforce and doesn't cost. I don't.
It does.
Well, it has
It does.
fees and.
It costs the OPR.
Yeah.
We'd have to get their
Yeah,
feedback.
so for sure, but I think it's worth a conversation.
Yeah. And I think a lot of the compacts that we have done over the years have actually are starting to have a pretty profound effect on them.
Positive
Um,
and negative?
Negative.
Profound effect on OPR,
Yeah.
because it's early
The
days.
funding. And
Their whole,
I
their whole
think
funding mechanisms.
the hope is that they had a different funding mechanism instead of
Paying for their whole
paying.
thing, but
Yeah,
it would be.
yeah, that's not realistic. I think that was my interest for the moment.
Great. I didn't write down the numbers. I just wrote compacts.
I've got them.
Okay.
But it doesn't, I was just thinking about Medicaid. It doesn't cost Medicaid anything. It does cost OPR.
Yeah.
Got my Medicaid hat on.
Lori.
I don't have a bill, but I would like us to take testimony on dental. So we've done the reimbursement rates. We've never been, no one has ever set up the program at Vermont State University, so I want to know what's going on there. And then there is a dental school opening here, so connected with Michigan, I think. So I just think like dental is so important, and we haven't done anything on that. So
Yeah.
just like some, accountability work.
Dental overview.
Yes.
The dental was it a dental therapist? What is the program that was set up
Yeah,
years
it
ago?
was-
It still hasn't.
And we gave them money.
Yeah.
And so to get an update, they had a guy, and the guy left. So we haven't gotten any updates.
Got someone to send for testimony for that.
Oh, we have Bill on it.
All right. Anything else, Lori?
I'm sure there is, but for now.
Anything you're really super interested on working on next year or a priority for you for next year?
I never thought that far ahead.
Daisy, did you wanna, no, I'm gonna go to Alan. Alan's.
Okay, I'll take the conservative. out of This, I think we gotta be very cautious what we do. I think Medicaid is probably the top of, I believe that Alex McCracken said our Medicaid cost right now is $2.2 billion. And it'd be nice if we knew what was coming and what's not coming. But I think this committee is gonna be very concerned. We talked about tough choices and, you know, money bills. There's gonna be others come along that were probably gonna be as important or if not more important than these. So don't want to kind of commit on something before we know how we're gonna pay for it. So I don't really have a priority there.
Okay, just don't spend any money.
No, I don't say don't
Or
spend
don't
any.
expand.
We got to, listen, we have no idea. And I almost voted no yesterday. Okay, because it's $1 million. And I know this will save us money. But if all of a sudden that puts Medicaid in jeopardy later on, it's going to come back to haunt us. You know, so yes, I think it's a worthy program, but the number of people that it would help, whereas down the road, we might have to have many that's going to be wanting something like this. So I think we got to be very cautious. We've all talked about it. I've heard reports from everybody how in dire need we are in healthcare. I think we've got to put our feet to the ground and do what's right financially, not just care. Anyway, I don't have any real bills up there that I'm excited about, but I think they're all important, but we got to watch what we're doing.
Do you have any interests in any particular, like, healthcare policy that
It's difficult to know without
concern
knowing.
you or your constituents?
It scares me to not know how we're gonna pay for something. I don't do that in my own life. Okay, and we seem to do that here, and it's warranted, but I think, you know, we don't want to dig a deeper hole or a higher cliff. That's what I don't want, so.
Tupper and then Lori.
I was just gonna say, I think we're all well aware of what's going on. But we should probably be well aware that, when the midterm elections come, that's gonna make the difference. One way or the
I
other.
don't think it's going to,
Well,
but that's everybody's different opinion.
everyone can have an opinion on it, but I don't want to look on, you know, I know we have to look on what's happening now because it's happening now. But once that midterm election takes place, it's going to go one way or the other. And it's nice to, you know, I'm all for tracking the thing, having people come in and tell us what they think is going to happen and so on. But I'm trying to be a bit more positive in what I think is going to happen.
I'm trying to be.
That's why-
Realistic.
I'm okay, and I'll be damn realistic when it comes time that I have to be. But right now, I'm thinking ahead. And not that I want to spend all kinds of money, that's not the issue. The issue is I'm thinking of people and what we have to do or what we're charged to do when we come in this legislature. We're supposed to make sure that people are safe. We're supposed to make sure that needs of people to help that, whether it's medical or however we do that, that we're willing to really look into it and do something about it. Make the big choice. Some of those times the big choice is, no, we can't do that because we don't have money. But I'm not going to let my life be run or determined by what's going on in Washington. I'm just not going to let that happen.
I'm not either, but I'm just saying, we've got to be aware
I agree with you.
of everything.
And I'm all 100% in on,
Because there's such a thing as healthcare financially too. People got to pay for everything.
that's
Not just
exactly
healthcare in
right.
their life, everything else. And that's healthcare.
Yeah, I agree with you.
Lori,
I just want to remind everyone that we in Vermont do not have a statute that we have to balance our budget, but every single year we do a balanced budget. So yes, things cost money, but we don't ever not know how we're going to pay for them because we do
Fine.
balance our budget.
we always, but listen, we always find a way to pay for it on the backs of the taxpayers somehow. We can up property tax, we can up sales tax, we can up every tax and they just have to pay it.
That is true, and I will say, we're working on property taxes with education, right? Like, we just passed tax credit bill, that's gonna help a lot of low and moderate income Vermonters. I just was uncomfortable with the statement that we don't know how we're gonna pay for it. We do balance our budget.
I'll agree with that.
Deb.
I'm interested in the 136, the biomarker.
I can't hear, I'm sorry.
136?
Biomarker.
Biomarkers?
84 with the telehealth recording.
Okay.
The interesting.
Mm-hmm.
I wrote down 12, but I don't remember what it is.
Well,
Feeding
it's addressing barriers to blenderized tube feeding.
That's just kind of, I don't know.
But it's a topic you'd like to learn about?
Amy? What, man?
Yeah.
I don't know. Non-money bills.
Which was the, I'm sorry, which was the, you mentioned 1 second, but I was trying to find. it.
84, I
84.
think it
Okay.
is.
Oh, the
Yeah.
telehealth
The
one. Yep.
telehealth one.
Yeah, testimony on that, right?
We did do some on
Yeah.
that.
All right.
And I think, didn't 112, didn't we put that in a Senate bill?
It's medical.
Yeah, that's.
Yes.
Yeah, that's,
It's 27.
it was S27.
Right.
I have a question.
Yes.
So looking at that list, it's kind of imposing, but I'm wondering if we could move to the side, things that aren't relevant anymore.
Yeah, because there's a
Like that.
doula bill
Or
over
that
there.
bill, or, you know, things that we have done.
We can come up with our own system of coding.
Yeah.
I think we can like put a little dot on it, which basically says this is.
Big red dot.
Color coding, right, Jim? Color coding.
Which would be very reassuring, like. to look-
How about a smile emoji?
Color.
Like smile emojis if it's passed in another bill.
H40 also, freestanding birth centers.
That's right.
Okay.
Emojis if it's impossible to
Woody.
accomplish.
Nothing's
impossible here.
Well, I did take a look at the list there and as Deb said, there were some things there. The tube feeding, I do remember Tiff Blooming coming to brief us on that. The dental issue, I remember Mary Kate briefing us on that.
Was a compact.
Yes, I think some of these things, like the food feeding, maybe not the biomarkers, but the tube feeding, that would be an interesting thing that we could take up right now. Start
Yeah.
looking at. It wouldn't.
Yeah, we could take testimony on it,
Also,
figure out what it is.
also, Bob Cooper, as I recall, raised the issue on the teleconferencing and being able to record it. That might be an easy one, an easy lift.
Yep, we did take a little testimony on that. We've done a walkthrough of H84.
Check. If we have, that's fine.
Yeah.
But I don't, well, anyways.
Yeah, we did a
This may have been more.
walkthrough. We did a walkthrough and then we did testimony around the use of AI. Because the reason they want to record is so that they can use AI. And then we did sort of that AI embedded in medical records testimony. I would be honest with you, I was planning on taking up H84 this year, and then the hospitals who had requested it said they'd like to wait till next year. So that's
I don't
why
know,
it sort of.
As far as the recordings go, I think Bob was talking about just the general person asking and getting permission to record some of the conversations, you know, his doctor. looking ahead, as Topper and I just discussed briefly, biomarkers, genetic testing. You know, testing things like such as autism, maybe Alzheimer's. I mean, those are things important as we get older. Also looking at maybe the possibility of trying to eradicate diseases now that were at one time eradicated or were very close to eradication. And because the fact that people are seeming to disregard vaccinations, those diseases have renewed, come back, and maybe look at somehow preventing those diseases from coming back and infecting the lungs in the future. I don't know.
I think that's a great topic to.
I love that topic, but it would be pretty controversial because.
Well-
Well, maybe we should just
Immunization.
learn,
It's about immunization.
Yeah.
I mean,
It is.
but we could learn
it's
about.
great. I mean, believe me, I'm all
We could
for
talk
it.
about more than that. We could talk about straight up genetic modification of people.
If you're gonna
That's
test for
coming.
autism.
Look, at you've already got us with two heads.
But we have new
Yeah, he's right.
populations coming to
Yeah, sure.
Vermont.
Yeah, that's why we had
Americans.
measles here. We had
Yeah.
measles.
We could talk about integration of technology into the human body that's coming.
Prosthetics, we already had that.
Okay, I haven't gotten to you, but I'm afraid I might skip over Brian. I'm afraid of what I'm gonna have to write down.
I could just leave early and make it easy for you.
Thanks, Woody. I think those are great topics.
Great topics.
Wendy.
I don't know, I'm feeling very naysayer today because I'm just so worried I'm worried about what the federal government's gonna do, and I know we're not supposed to. Look at Penny.
Don't look at me.
Agreeing with you. You
You're-
said you were gonna wait until I finally did it. Today I am.
knew it would happen.
It scares me what's gonna happen, but we still have to take care of each other. We really do.
And take care of yourself.
The biomarker thing just scares me a little bit because I'm worried about what insurance companies would end up doing with that. I don't know,
We
like,
got into a thing with UVM about that, and they wanted us to fund.
That was the genetic, yeah.
Genetic testing, and that didn't go anywhere, so I think it's complex. That's-
Yeah.
I mean, it's-
I would like to know more about it before.
Well, that's what I mean.
Yeah,
By taking it up, we're gonna learn about it.
absolutely. I would love to learn about it. I would. I think it's great for like the breast cancer thing and stuff like that. It does have its purposes for sure. But I would hate like to know at 27, I'm gonna get Alzheimer's and not get a job as a result of that. What was the other one that you did that? 'Cause I didn't remember, but
COVID, autism, Alzheimer's,
yeah.
eradication diseases.
Yeah. Do you know
True
what
TV.
Vermont is one of the most vaccinated states in? Yeah, polio's on its way back, tuberculosis is on its way back. We're like, so yeah, I would like to have a rosier outlook on life right now. Maybe tomorrow I will. Thank you.
It's Saturday, right?
I know, I will definitely
I will
tomorrow.
We could have a conference call.
I will never forget the genetics bill because it is where I learned what let it lie. Actually meant. I'll never forget Mari on the floor asking to let it lie. You remember that? She had to move. The
Well,
genetics bill.
Oh, yeah. That was frustrating.
That was frustrating.
one of the things that I worry about constantly is my grandkids are really close to me and they're worried as hell. And when I sit down with them, I try to talk to them about, sometimes you can't do anything about something. And if you keep letting it eat away at you,
Yeah.
it's just it's taken away from the rest of your life, You're in high school, enjoy it. And I hate to see them in that state.
You're right.
And that's why I'm saying that, some things are good. If they're down, go on there. But, some things are terrible. So that's how I feel about life. You can't let everything.
No, you can't. We do have.
You're gonna get sick.
And can I just add something to that? It's that I personally feel that we were each elected to make things better, to make it the best you can. And that's our responsibility. That's our job. That's why we are here. So no matter how bad we feel about, our hands being tied because of funding, how impossible it's going to be to choose priorities in that climate. It's your job to make it better for your constituents, not just for yourself. So
114,
look up
H
there.
114, the expansion of the Dr. Dinosaur thing, please.
Okay. H114. Okay,
Take care of our kids.
Leslie.
So, there's a lot here and I'm trying to think about how to filter it, like from a sort of priority point of view. And I was just wondering if we could, how I want to think about it is sort of like the impact on populations. So Lori brought up dental, impact on population too. So that when we take testimony, can we understand the impact on this bill on a particular population compared to blenderized tube feedings, which I certainly think if people are interested, great, but I think the population impact is going to be relatively small. So just trying to think about like PT, big, dental, big, Pulse, probably really, big and end of life stuff. So I'm just wondering if we could think about filters as we go forward on the impacts on the population.
Well, I have thoughts on what to do with this list, but Lori?
That's okay, good.
Okay. Well, go ahead.
I was just gonna say tube feeding, I think will be a big, I hate to say it, big deal in the future as we all get older.
I don't want that.
Well-
It's already written in my face.
No, but I mean, being serious.
No, I understand what you're saying, totally.
And to that point, it is a big deal for the families that need it
Absolutely.
now. And I would say, I agree that we have to look at the biggest impact of our population, but then we also need to factor in the cost impact. And so something potentially like that bill could have a big impact to a small number of families at a relatively
Sure.
small price.
Totally.
Right? So
Get it? Just trying to think how to think about this.
All right, everyone is like putting their hands up, trying to delay me getting to. No, I'm just-
Getting to it.
I keep like, and Brian,
And
and then
I'm like
everybody else is.
dragging myself through the meeting because I feel like I need to be
No.
part of this.
Wait a second, before you,
Yeah.
I just have two words.
Yeah.
Or 3 words,
Ooh.
universal health.
You've been heard.
All right, Woody, universal healthcare.
Woody thinks UVM should take over the entire system. We should change the name to the Universal Vermont Medical Center.
Let's
Okay.
finish.
So I had this
Going
dream
around
the
and-
other night that I was in like a nursing home hospital setting, and everyone in every room was screaming for help, and I was the only person there to help them, and I was running from room to room like all night long trying to help these like people crying for help. It was the most disturbing night, but I share that because that's kind of how I think it symbolizes what we're going through. Like I think it was my subconscious like processing what it feels like right now, and so I don't know what the answer is, but I think that it's unlikely it's going to get better before it gets worse. And so I think I said earlier a lot about like wanting to take stock of what we have and how to preserve as much of what we have and how to be creative about how to use, like make do with what we have. Like, like I'm just thinking about growing up, like my mother and father would just make do with what we had and we would figure it out and we would get by, and it wasn't always exactly what we wanted, but we got by. And so I think we're going to have to do that. So I don't have a lot of bills to point at because a lot of these bills are like, let's give everyone this, let's give everyone this, let's give everyone this when we can't. That being said, I do think that one way to get through this is to look at how to establish healthcare as a public good versus a commodity. And so that's, I think, looking at as things collapse and we try to configure financing to try to sustain access, can we move towards universality? You know, like, I'm not joking, you know, so there is the incremental implementation of Green Mountain Care on there. I think looking at the concept in that would be good at some point, like looking at what's proposed, how to start with universal primary care and build onto it. I think there's elements of that already in S-126. And so perhaps we could take some testimony on that bill, and it might inform what those committees do in S-126. Or maybe it will give our chair an idea, and then when there's a conference committee, it'll get woven in or something. So that would be my request. And then the other with bills, and the other thing, which I don't know if there's an exact bill for, is, not joking, looking at the cutting edge of the technology of genetics and artificial intelligence, because soon we'll be able to look at a genome and be able to give people exactly what they need at which point in their development to prevent diseases. And if we had a universal system where everyone was guaranteed that treatment, we could fix a lot of things before people get it. Like with the biomarker piece, like if that's used for a company to be like, we're not going to cover you, that's a problem. But if everyone is guaranteed coverage and we use that, then everyone will be offered what they need when they need it. And then could you imagine if we prevent the cancer, how much money that saves, you know, and how much suffering that saves. And so I think that even though things are going to collapse right now, it's inevitable. We don't know how much, but there's going to be a collapse. If we're studying how to rebuild smarter, and we keep investing in these technologies the right way and making sure they're not used for like malicious purposes, because they can be, like with the very same technology that could allow us to, for example, like these headbands that are coming out that will allow us to read brainwaves and then impact people's brainwaves. They could be used in a positive way to help people who commit crimes heal their brains so they don't commit crimes anymore. But the very same technology could be used to control people. And we're not, you know what I mean? So not to go off at a tangent, but the point is that we are on the edge of like major advance in technology that could really change the nature of the human condition and make it that it's like Star Trek, where everybody, you know, just is healthy, you know, or it could be like Terminator, you know? So we really need to stay on top of it. That's all.
Great.
Daisy, even for witnesses.
I have a list. The Nora Rights Foundation would be good, for example.
Are there other bills that
You're going there.
technology?
Well, the bill would be H-433. The other bill,
Need to be a bill.
yeah, the other bill is in another committee because it got sent there because it's commerce related. But I actually think that there's medical pieces to it. It's just that the commerce, like these headbands for video games are coming out in like a year, and it's gonna allow companies to record children's thoughts and sell them. And like that's why I'm not lying, and that's why it's in commerce. But that same technology could be used to revolutionize healthcare. So I can tell you the bill number if we want it. But the Nora Rights Foundation is the group I would want to bring in about that piece. And then I think just talking to the biomarker cancer society, like talking with them about coming in and presenting on how genetics can be used to prevent disease and to better treat disease.
All right, Daisy.
Brian, I love that you are probably, I think it's safe to say the most forward-thinking person in the healthcare committee. So many, like I'm looking at our list and all the bills up here, and many of them are ideas that constituents have come to us with, or some people, it's their own challenge in our system. And so it's a reactive need to a problem. But I love that you have these ideas that are really forward thinking, and you know, it's sort of like the way that I really hope we can be making policy someday, which is not a crisis response environment, but really anticipating the needs of Vermonters. So thank you for that forward thinking. I would like to talk about mental health. Imagine that. I I have a bill up there around, it's number 305. It's around psychotropic medications for youth.
Oh, yeah.
And it's a short form bill because I was trying to be nice to Katie McGlynn and Ledge Council, but I did some work over last summer to look into how many youth in Vermont are prescribed off-label medication for psychotropic medications off-label through Dr. Dinosaur. There are 9,200 kids or children and adolescents 0 to 17 being prescribed those drugs. And almost all of them, age 0 to 5, is off-label. So it means they're not approved by FDA. So we really don't know the potential side effects of that. And we want to look into, what rights and permissions their guardians have been given. And there's really not strong reporting coming out of DIVA on this. And given the number of kids and the various guardianship situations there, I think we need to have better reporting and oversight on this. So this bill would just allow us to have better oversight on those situations. And the issue came up to me through the Office of Human Rights, it's the national office there, because they were monitoring nationwide data and Vermont came up on their alarm. I flagged the issue to our Office of Healthcare Advocate, and they also agreed that it was something that was on their radar. So if time allows, that is something I think we should take up for testimony. It's 305. The other one is 325, which has a funky name. So many of you might have overlooked it, but it's 323, Topper named it. It's mental health programming funded by the Mental Health Innovation Special Fund.
Oh, that's
It's-
good, sorry.
Yeah, it's really a youth mental health focused bill. So school-based mental health, which has a peer-to-peer piece in it where there's, youth in the school that, would have be trained to support each other youth. And that would complement the peer certification bill that we passed last year. They would be overseen by that. And also just, scaling up and supporting some of the free trainings that NAMI does. And giving those to the teachers so they're able to, feel better equipped with the issues that they're already dealing with. There's a couple more components, you can read it yourself, but we really have not done anything for mental health. The other one, I'm curious about what we can do with technology and AI in mental health. I think it'd be really smart of us to explore that. I think it's an exciting topic. We had testimony earlier this session, and grateful to Alyssa for bringing that up. And 75, age 75, the end of life, patient choice at end of life is something near and dear to me. I'm curious about the prosthetic coverage bill 432.
Okay.
And 75.
I
Oh, I named 75.
hope you're writing down your choices.
I am.
Okay.
Can I comment on one of the things?
Yeah, I'd like to
Quickly.
finish up here.
I would too. I'll make it quick. Just that in the 90s, we saw a policy where doctors were encouraged to treat pain as the fifth vital sign, and pain medications were given out to everyone. And then those very same companies, after we had opioid addiction, created the cure, methadone, buprenorphine, et cetera. I'm highly concerned at the amount of children being given methamphetamines right now, Adderall, ADHD meds. And as pharmaceutical companies are racing to patent ibogaine, the only substance known to humans that treats psychostimulant addiction, to see which company can own it first. So I think we should really look into the medication issue for many reasons, but I just want to share that, I'm really concerned about that we're being set up for another wave of another generation being turned into people struggling with substance use disorder issues, so that the pharmaceutical companies can make the cure for the problem they created. Anyway, thank you for letting me vent that out. But it was when you brought that up, I was glad, because we haven't really looked at that a lot.
Leslie,
Thank you for that venting, which then triggered my venting, which is how the population is being poisoned by sugar
Oh,
and being sick and obese and profit going to sugar manufacturers. And then, once they're sick with diabetes, profit going to drug manufacturers for the cure. One of the students did a sugary drink tax analysis. And I know people think it's regressive and it's really struggle with that idea. But I think it's pretty clear that what changes behavior is tax. It certainly works with cigarettes and alcohol. I know that sugary drinks tax would be really controversial. But I think we need to really think about how we help our population get healthier earlier. And that's just one way to think about it from that point of view, because half of our population dies of heart disease, which is a consequence of diabetes and, it's just.
American diet.
Yeah, and our diet and everything. So I don't know, it's,
saw some numbers recently on Vermont specific around our rates of obesity and obesity in childhood. And they've gone up significantly, and Vermont used to always be one of the lowest. We actually have not done. So we haven't done a lot of testimony just around obesity, and of course it goes into our healthcare costs because a lot of medications are on the top list of most expensive. So do I get to say?
can I just add one thing? I'm sorry.
Yeah.
Rhonda Williams was here. I don't know if you remember, but she gave us a report on the 10 things that would reduce, access, exposure, let's say, to sugar. It's a great report. That was earlier. No, it must have been last session. I think it was last session. So it might be worth a revisit.
So population health, more on population health.
Population health,
Yeah.
for sure.
And then you
I
go,
got sugar.
you go now? Is that what you were trying to say a minute ago?
Yeah.
Okay, yeah, I want to hear what you have to say. Yeah, let's listen.
Oh,
Right.
actually, I have a couple things that I want to work on for next year. 71. Which is the, no, I'm sorry, not 71, 70. Yeah, 71. PE. Yes, private equity.
Oh, yeah.
Private equity.
Oh, yeah.
And really what I really want to work on, or what I want us to spend time on, is accountability. We are, hopefully, if 126 passes and goes into law, we've got a lot of accountability in that. I really want to ensure that we're staying on top of that and not just sending this out into the world and hoping that it goes forth with the urgency we want. I think just work around that. But my real aim is I really would like everyone. I sort of would like everyone to have a little bit of ownership over something that they're passionate about, or maybe not even passionate about, but a topic or an idea that, and it doesn't have to be a bill on this wall, that they want to sort of delve into. And I think sometimes you're more engaged in the work that we're doing when you have a personal stake in the work that you're doing, even if it's something so little and tiny. And I will turn to our healthcare advocate, who oftentimes has like a running list of little things that he'd like to.
I was actually going to, Mike Fisher, I was actually going to ask
For ideas.
some guidance earlier in the year, and thank you, Chair, for mentioning private equity. Earlier in the year, we presented on private equity and started some process with provider groups. There's kind of a chunk of work for the advocate's office to engage in with provider groups around private equity if we're gonna have something workable for you. And so I was asking for some guidance if we want the HCA to engage in that this interim, we're poised to do it.
It was my understanding that throughout the summer, there would be
We're done with rate review and
Yes.
hospital budgets and
yeah.
All that other stuff.
But yeah, I mean, there are little topics and, I mean, I know that when I was new, and it doesn't seem like it, so our former chair, Bill Lippert, said, here, the healthcare advocate has this idea. Go forth and work on it. And for a new member, it was like, oh, I get to sink my teeth into something and like researching it and talking to people and lining up testimony. And it made it a very personal, fulfilling thing for me. I still get misty-eyed when I think about it. So, I'd like people to be thinking about that through the summer of, something that you would like to learn about and champion. Not that I'm sure that you don't have lots of other things that might go to other committees, but I would really, really encourage that. And it doesn't have to be something huge, doesn't have to be something monumental, it doesn't have to be something that costs any money. It could just be an idea and a small thing.
Right, thank you.
So, anyways. All right, so I think we're done for the day.
Thank you.
Thanks, everyone.